Welcome back to the Green Room, where we cut through the noise and get to the heart of the stories shaping our health, our culture, and our lives. Yes, I'm still here. It's Chris, and we're gonna dive into a topic that's hitting headlines. It's stirring up a lot of confusion and even some fear, some misinformation as well. As President Donald Trump, alongside Secretary of HHS, which is the Human Health Services, Robert F. Kennedy, just recently did a press release on pregnant women to not take Tylenol, claiming that it's linked to autism. Now, let me remind you, the FDA has been put pressured and they issued warnings, but the major problem is the medical community and global health organization says the evidence simply does not support this claim. So what's going on here? Why does this matter? And how should we actually think about Tylenol, pregnancy, and autism? Now, stick with me, and I'm sure we can have a better understanding after this. Now, let's start with the claim itself. Trump said point blank during this press release, do not take Tylenol if you're pregnant. And then Kennedy further suggestion that acetaminophen, which is Tylenol, the Tylenol brand name is the brand name, has a very increasing risk of causing autism. Now, that kind of language makes headlines. It also spreads like wildfire on social media, where nuance often goes to die. But here's the reality in this. The research linking Tylenol use in pregnancy to autism is associational. That means some studies have found patterns, correlations between mothers who reported using acetaminophen and children later diagnosed with autism or ADHD. But let's be very clear here. Correlation is not causation. Just because two things appear together doesn't mean one causes the other. Now you might ask, what does the science actually say? So what does the science say? The World Health Organization, the American College of Obstetricians and Gynecologists, and the Society for Maternal Fetal Medicine all agree with this one statement. There is no consistent evidence proving Tylenol causes autism. In fact, a massive Swedish study involving almost 2.5 million children found no meaningful increase in autism and risk once they adjusted for other factors. Now you ask yourself, why does this matter? Because it's possible the reasons women take Tylenol, like fever, infections, or severe pain, are the real culprits. Now we know fever in early pregnancies, for example, is strongly linked to risk of miscarriage and birth defects. So imagine telling a pregnant woman to just tough it out and avoid Tylenol when the untreated fever itself may be more dangerous than the medication. Come on, y'all. Now let's discuss the expert consensus. Here's what doctors, and I emphasize doctors in this field, are saying. Dr. Celine Gounder, hopefully I pronounced your name right. My apologies if I didn't. A respected medical commentator said bluntly, the best evidence does not show an association between Tylenol and autism. The American College of Obstetricians and Gynecologists called Trump's statement very irresponsible and worried it could spark unnecessary fear. Now, the World Health Organization, who has flat out just rejected the idea of the causal link, encouraging women to follow their doctor's advice instead. I cannot say that more blunt. Follow your doctor's advice. Your doctor's. And here's something very important. Acetaminophen is one of the few over-the-counter pain relievers that's considered safe during pregnancy, the entire pregnancy. Alternatives like ibuprofen and aspirin carry real, documented risks at certain stages. So when leaders tell women not to take Tylenol at all, it doesn't just go against the science. It may push them toward worse outcomes. Now, all together, let's put this together and show you why it's important that we get this message out clear and correct. I ask you this, why does this matter beyond the Tylenol bottle in your medicine cabinet? Because public trust is at stake. When political figures make sweeping health claims that go beyond what science supports, people start to doubt everything. Some women may now avoid a safe medication they genuinely need. Others, they may question whether doctors are hiding the truth. And in the middle, pregnant women already navigating in an emotional and vulnerable season are left with fear instead of facts. Now, we've seen this before in recent events with vaccines, with masks, with countless health issues where politics overtakes science. The result is confusion, mistrust, and sometimes real harm. Now, through this entire incident, there's something we can learn. And here's that takeaway. Health guidance should be built on evidence, not politics, not sound bites, evidence. That doesn't mean science is always perfect or final. In fact, science is constantly evolving, but we need to make sure responsible leaders are acknowledging uncertainty. They communicate nuance, they don't overstate or scare people into decisions that might backfire. For pregnant women, the safest path is this. Use Tylenol when it's medically necessary, not casually. Plain and simple. If anything, take the lowest effective dose for the shortest time needed. And most importantly, talk to your doctor because your health, your baby's health, and your peace of mind all matters too much to be driven by headlines. Now, as we're coming to a close, it's good to be back, and I will explain where my highs came from in future episodes. But this whole episode is a reminder of how important it is to slow down, look past the noise, and ask, what does the evidence actually say? Science isn't about finding simple villains or heroes. It's about weighing risk, understanding the context, and making the best decision with the knowledge that we have at this time. So next time a politician or celebrity or even a neighbor on Facebook says, don't do this, it causes autism, remember to pause, ask, what does the doctor say? What does the research say? And if there is actual evidence to back it up, pregnancy is already a season full of decisions and anxieties. The last thing we need is anyone making it a fear. And this fear based on shaky claims at best. So let's choose to trust in science, care from our doctors, and compassion for each other over sound bites that stirs panic. Now that's it for today. Short and sweet. Still the green room. And if you found this conversation helpful, please share it to someone who might need clarity in the middle of all this noise. And remember, here we aim to bring truth to the table that's grounded in research and guided by real conversation. Thanks for listening. Until next time, I'm Chris. Please stay informed, please stay thoughtful, and please stay rooted in what's real. But what's real here is that we are here together to navigate this world. Peace.